Hello everybody and welcome to another episode of Ask Dr. Bob. And I know last week I told you I would discuss summer exercises. This is the time of the year that you want to be outside as much as you possibly can. And I want you to know for myself personally, I ride my bike every day. So you want some kind of aerobic activity. The reason I ride a bike is it doesn't cause pain like pounding on pavement would if you're going to be jogging, running, or walking. I know a lot of people like to do fast walking. Think about bicycling. I also rollerblade on a regular basis. Now you have to be quite agile to rollerblade because I'm going to tell you right now, the concrete and blacktop, it is unforgiving. When you hit hard. I also want you to know for myself personally that I do a lot of weightlifting year-round, but you could get some aerobic type of exercise that you could do also with bands. You want to be outside in the sun. The reason is that you want the sunshine to convert the cholesterol in your skin to vitamin D. So I'm going to answer a question of one of the Ask Dr. Bob questions as a part of our summertime exercise. Because I had two people this past week, and this is a kid answer that talked about their children and swimming lessons, and they're concerned. They read in one of our books about chlorine and what it can do to the body. So here's what's going on. A great summertime exercise, of course, is swimming. Swimming is tremendous. But, it's the big but, you would love to go swimming in the ocean somewhere or the Gulf of Mexico, so let that salt water absorb into your body. That is the very best swimming, ocean water. But if you don't have access to the ocean water and you're in a pool, here's what I'm going to suggest. So this is so important. I'm going to save you a lot of misery. Back in the 1960s, I played hot stove baseball. And at that same time, I was probably about in the 4th or the 5th grade, I started to have pain in my hip, and my ankles, and my knees. I mean, I was a crybaby. And if I had been my dad for myself, I'm not sure what I would have done. But my dad took me to these different doctors. They did ultrasound to me and everything. It wasn't until I went to college and found out I had a low thyroid. You say, what does that have to do with swimming, Dr. Bob? Chlorine, bromine, and fluorine take iodine out of your body. So moms, if you have children right now, especially rough and tumble boys and girls, and you have them in swimming lessons, they come home and they're whining and complaining that this hurts and that hurts. Don't do like I would have done to myself way back then. They probably have a low thyroid gland. Now, you don't want to just indiscriminately take iodine. I take 12 milligrams of iodine a day. We have some liquid iodine that's available to you. It's liquid iodine forte. You could have them take 30 drops. They're in micrograms of iodine. Growing pains could be an iodine deficiency, could be a lack of calcium, but chlorine, bromine, and fluorine deplete iodine. Migrating joint pain, growing pains, think low thyroid. They might also complain of cold hands and cold feet. But that was a really important point. We never really had anybody ask the same question 2 times. Dr. Bob, do you have any advice in regard to neuropathy? Well, neuropathy happens to be nerve pain, and oftentimes somebody might be a diabetic. What happens with a diabetic is that you have reduced blood flow to nerves. So if you are diabetic, your neuropathy could be a part of that. But I oftentimes see lack of B vitamins. B vitamins are important for optimal nerve function, and so is oil, optimal EFAs, essential fatty acids. You could take 1 tablespoon of flax oil per 100 pounds. We use a low dosage B vitamin. It's a B complex. You could take up to 3 a day. Dr. Bob, I just bought my first organic plant yesterday. Any growing suggestions for success? Of course. There is a product called Plant Tone. It's organic fertilizer. 1 scoop directly on the plant soil. Water it every 2 weeks. You'll be amazed what Plant Tone will do. It actually just reminded me I have to do it to my basil plant when I get home. Dr. Bob, how or where can I have my vitamin D levels checked? This is really an important question. You could contact us. We'd be happy to send you a kit. You can do the pinprick from your little finger or a lance prick in the comfort of your own home. You would like to have your vitamin D level be at least 40. I just had someone who recently came into our office. Her vitamin D level is 19. She has chronic infections going in her body. Everybody should have their vitamin D level checked at least once a year and follow the pattern. During the summertime, I have found that the vitamin D level is usually the highest, starts to go away about 4 to 6 weeks after the sun leaves. You can contact us. We'd be happy to service you. Dr. Bob, you talked about left neck pain. What about right neck pain and shoulder pain? Good question. Gallbladder and liver typically cause right shoulder pain, right neck pain. You also might have pain on your right knee. You may have digestive distress with radishes and cucumbers, onions, green peppers. Radishes, cucumbers, onions, and green peppers. Radishes are a digestive herb which put a demand on the liver gallbladder. So that would help you a lot. Right shoulder pain. You also might have metal taste in your mouth. Dr. Bob, how can I help my gallstones? Now this is also significant because you may have right shoulder blade pain. Now in our practice, we always encourage our patients to eat apples. Apples help thin bile. Malic acid. Malic acid will help thin bile. I eat a half a red apple every day. What foods are good for gallstones? Well, I can tell you want to avoid fatty foods for a season. We use a product that has bile salts in it. It's called Beta Plus. We usually have our practice members take 1 a day, then 2 a day, then 3 a day. Beta Plus, any kind of bile salts. You get it from your local health food store, but you want those apples. Apples thin bile. And here's something else that just came to my thought process for you. If you're under a lot of stress, stress causes an acid pH in your body. You may need some alkaline food because bile is alkaline and will be used up and become thick, pasty bile if you're underneath a lot of stress and have an acid pH. And if you happen to have red hair and freckles, you will also have thick, pasty bile. The best way to reduce those freckles and red hair, more zinc. Stay away from wheat and soy. So that will help you. So then I have another continue on with this question. So what do I do with my gallbladder, Dr. Bob? Well, we use something called the castor oil pack. You basically get wool flannel and you put castor oil on it, and the castor oil itself on that wool flannel, you put it on your liver, which is located on the right part of your body. That castor oil on the wool flannel on your liver will promote healing of your liver itself, and it's going to also promote healing of that liver gallbladder mechanism, but you want to be eating those apples. This person went on to say that they take a product called pawpaw and papaya. Papaya is a great digestive enzyme. I'm not saying it won't help your gallbladder, but it won't help it the same as an apple would. And the castor oil pack, which you could do at least twice a week. My wife Debbie did it every day for a year when she was 30 years old. Okay. Do you have any advice for any kind of supplements to get my health back? Well, you know, that's like the age-old question. Dr. Bob, do you have something that could take back the hands of time? I think the most important thing is drink water from a pure source. Minerals are very important. But I really can't make any suggestions unless I knew a little bit more about you. So I'm just trying to be very kind. Dr. Bob, where can you get reverse osmosis? You could pretty much get reverse osmosis units now pretty much at any major box store. What do you mean box store? Lowe's, Home Depot, I'm sure even Walmart has them. You can probably go to Amazon. The biggest thing is you want to have easy access to the filters and the reverse osmosis membrane. Before I close, I want you to know that we just updated Dr. Bob's Drugless Guide to Balancing Female Hormones. I also want you to know that Dr. Bob's Men's Health is on audio, and the ADHD book will be updated soon. So watch our website. We're going to be updating the cover soon. The books are available right now. So wherever you're at, anywhere in the world, I'd be happy to make that book available to you. And next week, what I want to focus on is I want to talk about thinning hair. And I know we may have talked about that in the past, but I just really feel compelled to discuss that with you now because I'm having more and more practice members come into the office and they have thin hair. You guys have a great week, and I'll talk to you next time.